Welcome guys to my YouTube channel. My name is Nasan and today I'm here to talk about clinical features of cancer of the cervix. Cancer of the cervix is the cancer that affects the cervical part of woman's reproductive system. Cervix is located at the lower portion of the uterus and at the junction of the vagina. Most of these clinical features or signs and symptoms go unnoticed just because most women are not able to differentiate between normal and abnormal and other signs and symptoms that most of us women experience. That is why we are here today to talk or to point out some of the clinical features that will alert you as a woman to know that this might not be normal and therefore I need to go and see my gynecologist or a doctor before it is too late. First, we have said that it is caused by human papilloma virus, which is transmitted through sexual intercourse. Therefore, we need to watch out some of these features. Like the most important features are bleeding or abnormal vaginal bleeding. We all know that women will do menstruate. That's vaginal bleeding. But I'm talking about abnormal vaginal bleeding, whereby maybe you are having heavy menstrual period, or rather in the menstrual period. You have already finished your menstrual period and then all of a sudden you start bleeding again. It's not a good sign. You need to watch out and find out other factors remaining constant. We will say that this might be a, a sign that is alerting me that there is something wrong. Also, when we are having sex and during sex or after sex you are having vaginal bleeding, it's an alarming. You are not supposed to have fresh bleeding during sex or after sex if you are not in your menstrual period. Also, women do experience after menopausal bleeding. You stopped having your periods long time ago and then all of a sudden you start having periods again. That is after 50. We say that cancer of the cervix, those who are predisposed most of the time are from 50 to 65 years of age. Therefore, if you are already menopaused or you stopped having a period, then all of a sudden you start having PV bleeding or you're having vaginal bleeding, is not a good sign, because this is always a sign that indicates that this cancer has started spreading towards or already is coming to the vagina. That's why during sex, any trauma or any friction will cause the inflammatory process or will cause the bleeding. Also, if you start having bloody stool is when you see blood in your stool. It's alarming because cancer of the cervix, as we know, it is proximal to the rectum, to the vagina, to the uterus, and other organs that are around. So if you see bloody stool, then it is a sign that this cancer is either spreading to the colon, and that's why you are having this rectal bleeding. Vaginal discomfort is not good. Anytime you're having sex and you find that you have painful sex, this is because of the inflammation process or the spread to the vagina. That's why when you have sex, you feel pain. Also, pelvic discomfort. Your pelvic region feels full, feels heavy. As we talked about, we say that pelvic is proximal to the cervix, and it is at risk to also have the effect of the spread or metastasis to the pelvic region. Therefore, pelvic will also feel like it is heavy. It is like you are feeling pressure there. Therefore, you need to watch out for all these signs. You will also feel like you are constipated. Constipation is always caused by other factors, or it can be caused by other factors. But now, in this process of cancer of the cervix, then constipation will be due to maybe the spread of the cancer to the rectum or colon region or other part of the digestion system. Therefore, it will affect the digestion system and elimination process, or causes obstruction leading to bloody stool. We talked about blood stool. Now this will also cause constipation, and if it forces its way out, therefore you might end up having bloody stool. As a woman, you are just fatigued is another sign. You are tired, you have just woken up, or you have not done much, but you feel always tired. Tiredness can be caused by other things. We talked about bleeding. You are losing blood. Your level of blood is going down. Therefore, will also be one of the reasons as to why you are feeling tired, and also cancer is spreading in the system. It makes you weak. You are always tired and you feel like you just want to rest, just want to sleep. You are losing weight. Weight loss. Weight loss due to unknown reason. Maybe you are not dieting, you are not doing exercise, but you are just losing your weight. Maybe you are 50 kgs, for example, and all of a sudden you are coming down to 30 to 40 to 35, and other factors remain constant. You don't feel sick anywhere. Maybe you are not on any medication, or you are not on anything, but you are just losing weight. It is a sign, an alarming sign, that your body is not doing well. You will also end up having urine retention. Urine retention is the process of not being able to eliminate urine or to initiate urination. This is because of the pressure to the urethra or inflammation to the urethra that helps to eliminate urine. If you start having urine retention as a woman, and you are at risk, therefore you need to see your gynecologist. Painful menstruation. You are able to pass urine now, but it is painful. Urethra is inflamed and it is now becoming irritable. It is painful. It is not a good sign at all. Back pain as a woman is another sign. You are always having persistent back pain that doesn't respond to treatment, and maybe you did not have trauma like accident or disc prolapse, anything that concerns back, but now you're having back pain. Back pain is always a sign for cancer of the cervix due to spread of the cancer to the back region, spread to the back region. So you start having back pain. It's always good to rule out other factors, but it's always also good for you to do screening.